way of coping, right, and is centered within certain queer spaces. So working with individuals in that community to learn how to connect and also to address the substance use that has come from possible trauma in their life. Hello, my name is Tyler Saran. I'm the program director here for Clear Behavioral Health in Pasadena. We work with both teens and adults in primary mental health, PHP and IOP programs. I'm a current board-registered associate professional clinical counselor, and I've been working with Clear for about 2 years. A lot of the issues that we see co-occurring with clients who identify as LGBTQ is often things such as trauma, rejection, feelings of isolation or loneliness, as well as substance use. Substance use is a major concern within the LGBTQ community, and often is a way of coping, right, and is centered within certain queer spaces. So working with individuals in that community to learn how to connect and also to address the substance use that has come from possible trauma in their life. We see all sorts of mental health conditions, but some of the trends that we definitely see in majority is anxiety, depression, PTSD, and mood disorders such as bipolar or things of that nature. I think LGBTQ affirming mental health treatment is important, just the way as any other affirming care is important. Being in the care of someone who understands your experience and has done the work to at least understand and research the experience of those communities that maybe they don't align with really shows up in the therapeutic work and in the room. I think the difference working with queer or LGBTQ clients that are adults versus teens is really looking at where they're at in their journey of coming out, coming into their own, and also seeing if the family is going to be able to hold that information in a healthy way. So for the teens, often it looks like really seeing if the family and working with the family to get to a place to meet the client in a way that's healthy. Whereas with adults, they might be a little bit further along in their journey, sometimes not. And it can be processing past events of feeling rejected, isolated, or other damaging mental health things. So when looking for an LGBTQ identified clinician, I think it's really important to assess if the person that you are meeting with feels like the right fit. Our team is phenomenal and intentional when it comes to approaching the needs of every client. And when we're talking about clients in the LGBTQ community, we really do prioritize the respect of, honoring the names, the pronouns that the client is deciding to use, and working with family members to have those difficult conversations with those teens. So maybe it looks like working with the parents before a teen discusses it with them, or working with the teen of how to have a healthy conversation that we can mediate in a therapeutic environment. So if someone comes to us and is in our care and is needing additional resources such as LGBTQ support groups, we have the option with our case manager to really find any outside resources that they feel is needed in addition to our programming here. Although we aren't a specific LGBTQ center, I think it's important to recognize that our community is affirming in nature and that the employees and staff here really do value the respect and dignity of every client, but specifically those that identify in the LGBTQ community. Maintaining the expectation that pronouns are respected in groups, continuing education provided to staff on LGBTQ affirming care, or differences in policies that might be impacting the clients with those identities is something that is ongoing. The clear model in general does have a foundation that supports people in the LGBTQ community and outside of the LGBTQ community, especially in that form of connection. I previously mentioned that connection and isolation is something that those individuals really do suffer from, and having a healthy space such as treatment to come and be honest and open and feel accepted is truly one of the biggest benefits of being in treatment for individuals of those identities.